This is Jeremy with CryoClarity, and in this video we're going to be once again talking about the heart valves. So this video is meant to be a part 2 to my original video, and in this one we're just going to be giving unique ways to remember which valves are located where. So if you haven't watched that video, it'll go a little bit more in depth and tell you some things that this video won't. So to give a quick recap, we have 4 valves associated with the heart: the tricuspid valve, the mitral valve as our atrioventricular valves, and the pulmonary valve and the aortic valve as our semilunar valves. Looking a little bit closer, whenever we try to remember where these valves are located, if we take a second and remember from the blood flow video, or just going off our dome, 3 venous structures dump into this right atrium. Those are the superior vena cava, the inferior vena cava, and the coronary sinus, which is seen on the posterior aspect of this heart model and of the heart. So that's 3 venous structures dumping in to the right atrium. The reason I'm highlighting that is because the tricuspid valve has 3 leaflets or cusps. Therefore, if we remember that 3 venous structures dump into the right atrium, then we can remember that the right atrioventricular valve has 3 leaflets or cusps. Or, being since this right atrioventricular valve is literally termed the tricuspid valve, with tri telling us there are 3, then we can just reverse that attribution and know that on the right side of the heart, where we have the tricuspid valve that has 3 leaflets or cusps, that is also the side of the heart where 3 venous structures enter the right atrium. That's also important because on the left side of the heart, 4 structures dump into the left atrium. So 3 leaflets and 3 venous structures, 4 pulmonary veins dump into this left atrium. And we can either half that to remember that this mitral or bicuspid valve has 2 leaflets or cusps and is on the left side, or we can remember that the 4 structures that dump here are 2 left pulmonary veins and 2 right pulmonary veins, and therefore we have 2 leaflets or cusps on this mitral or bicuspid valve. And just as we reverse that attribution on the right side, we can do it here on the left as well. The pulmonary valve takes us to the lungs, or to pulmonary circulation. So we know that that's going to be after the right ventricle. As we know, after the left ventricle, that takes us to systemic circulation through the aorta. Therefore, that would be the aortic valve.